My top 5 prescription medications for hypertension. Here they are. I'm Dr. EvanLevine, board certified cardiologist. If you enjoy my videos, please follow, like, and share. These are not in any order because no drug fits everyone. Number 1, hydrochlorothiazide or chlorthalidone. These are diuretics. I still prescribe a bit more chlorthalidone than hydrochlorothiazide, but a recent study showed they're basically equivalent. They work great and they're really inexpensive. Let's go through the pluses. Again, inexpensive, once a day, can help prevent kidney stones in many patients. They help with edema, swelling of the ankles, and they're great to add to other blood pressure medicines as a combination pill. They lower potassium for people who need it lowered, and they may reduce the risk of osteoporosis. The minuses. They may slightly increase the risk of gout. They can lower your sodium and potassium. They transiently can increase triglycerides and they raise calcium. Some note a light increased risk of urination. Number 2, ARBs, angiotensin receptor blockers. Losartan, valsartan, anything that ends in an ARTAN, olmesartan. Get it? The pluses. Once a day, inexpensive, can combine in one pill with lots of others, and they help reduce protein in the urine. They're helpful in heart failure for people who cannot take drugs like Entresto. There's no cough, and angioedema, a big complication, is very, very rare. The minuses, they raise potassium. Number 3, dihydropyridine calcium blockers. Yep, there are 2 types of calcium blockers, and they should not be used interchangeably. No. These end in a pine, P-I-N-E, like amlodipine and nifedipine, the most common. Let's go for the pros. Work well. They don't slow the heart rate. They don't cause constipation. Now, amlodipine can help a little bit with angina, and amlodipine can be combined with lots of other pills in a mega pill, making things easier, like an ARB and thiazide and amlodipine all in one. It's generic, but some insurances still won't cover it. It could be a PBM thing, a pharmacy benefit manager thing. Cons, it can cause edema and swelling in the legs, and gum swelling called gum hyperplasia. It's pretty ugly stuff when your gums start to bleed as well. Any good dentist knows this. Now, Procardia is a dangerous drug in heart failure, and Procardia is less tolerated and hardly used by me except in pregnancy. We know it's safe for the baby when we have no other choices. Number 4, the other calcium blockers, verapamil and diltiazem. Now the pros, they work well, they're inexpensive, they slow the heart rate. So if the doctor needs to slow your heart rate because you're in atrial fibrillation, it's going fast, it can help. They also help with angina. And verapamil I find very effective for chronic diarrhea and in cluster migraines. The cons, they interact with lots of drugs like Eliquis and the statins, and verapamil constipates many, slows the heart rate, and they're both bad for heart failure. Number 5, spironolactone and pleuronone, the mineralocorticoid antagonists, MRAs. The pros, they're great for resistant hypertension, powerful treatment for heart failure. In fact, every heart failure patient who tolerates this should be on it. It's cheap and works well. They lower protein in the urine, and again, spironolactone is also helpful for acne, hirsutism, and my personal experience, menopausal symptoms. The cons, for spironolactone, 10% get enlargement of breast tissue, which can be tender, especially in men, and it raises potassium. Some note a slight increase in GERD. Not in my top 5. ACE inhibitors like lisinopril, because 10% of people get cough, and a minority can get a very serious condition called angioedema. So I just use those ARBs. Beta blockers, not my top 5 because it makes them feel tired. It slows metabolism, slows the heart rate, can raise sugars, it may lead to weight gain. Alpha blockers like doxazosin, not in my top 5 because it's poorly tolerated, and in the ALLHAT trial, ALLHAT, increased the risk of heart failure. Alpha-2 agonists like clonidine, causes fatigue, a terrible cut in your dry mouth, and boom, rebound, which means if you get your dose, your blood pressure soars. Hydralazine, not in my top list because it's poorly tolerated. You got to take it 3 times a day. And Procardia, I mentioned that as well. Anyway, folks, I hope that helps. I hope that was fast enough. Please reach out and ask questions about this if you have. Happy New Year again.